This video, what is a prostate? How the prostate changes as you age. Foods to eat and avoid or limit when you have prostate problems. Prostate changes that are not cancer. Welcome to Medical Made Easy. What is a prostate? Let's first talk about the prostate. It is a little gland that surrounds the urethra and is located at the base of your bladder. It resembles a walnut. Alright, so we'll be talking about this a little bit more to make sense of the analogies I kind of use. Let me explain. It produces a fluid that aids in the movement of sperm during ejaculation. It also converts testosterone into DHT, a more potent form of testosterone. The prostate grows to a normal size in a man's early 20s, but it then begins to grow again in his mid-40s to early 50s, and it just keeps growing. Unfortunately, this will lead to some problems. How the prostate changes as you age. The way your prostate alters with age, the prostate gland can compress the urethra and make it difficult to pass pee, since it tends to enlarge with age. Men in their 30s and 40s may occasionally have these symptoms related to the urinary system and require medical treatment. Others don't become aware of their symptoms until much later in life. Prostate enlargement might also result from a tumor or infection. If you have any of the urinary symptoms described below, make sure to notify your doctor. If you have any of the following symptoms when you urinate, these are urge, the need to urinate frequently throughout the day, pass more pee during the day, have reduced urine flow, feel burning when you pass urine, need to get up frequently during the night to pass urine. Prostate issues are more common in elderly adults. Prostate cancer, enlarged prostate BPH, or benign prostatic hyperplasia, and inflammation prostatitis are the three most prevalent issues relating to the prostate. A change does not always result in another problem. Prostate cancer risk is not increased, for instance, by prostatitis or enlargement of the prostate. Additionally, it is conceivable for you to be dealing with many conditions at once. Foods to eat. Prostate health may be enhanced by eating a diet high in fruits, vegetables, and healthy fats like the Mediterranean diet. According to research, following this diet can enhance health, lessen the chance of getting prostate cancer, and limit the growth of the prostate. Antioxidants and good fats, which are abundant in the Mediterranean diet and other comparable diets, can help protect the prostate. Among the particular foods one should eat are salmon, packed with omega-3 fatty acids, which help prevent and lessen inflammation in the body. Salmon is high in healthy fats. These lipids are also abundant in other cold water fish such as trout and sardines. Tomatoes, packed with antioxidant lycopene. Tomatoes may help prostate gland cells. Lycopene is released and becomes more easily absorbed by the body when tomatoes are cooked, as in tomato sauce or soup. Berries, antioxidants such as those found in strawberries, blueberries, raspberries, and blackberries, assist the body rid itself of free radicals. Over time, free radicals can lead to damage and illness. since they are the result of processes that take place within the body. Broccoli, a substance called sulforaphane, is present in broccoli and other cruciferous vegetables such as bok choy, cauliflower, Brussels sprouts, and cabbage. This is supposed to target cancer cells and support a prostate that is healthy. Nuts are a good source of trace mineral, zinc. The prostate has significant levels of zinc, which may assist balanced DHT and testosterone. In addition to nuts, foods high in zinc include shellfish and legumes. Citrus, vitamin C, which is abundant in oranges, lemons, limes, and grapefruits, may help protect the prostate gland. Additionally, some research on plant extract therapy has demonstrated beneficial effects on prostate size and urine flow. One such extract is saw palmetto, which is an extract from a species of palm tree. However, more study is required. Foods to avoid or limit. Eating a well-balanced meal is not the only aspect of a healthy diet for an enlarged prostate. It also entails staying away from other food categories that are bad for the prostate. Foods to stay away from include red meat, rich in saturated fats. Red meat has the potential to aggravate inflammation. As part of a healthy diet, cutting less on red meat helps improve muscle tone and prostate development. Caffeine has the potential to operate as a diuretic, which means that it can increase the amount, frequency, and urgency of urine needs. Alcohol. Excessive alcohol intake can negatively impact the prostate as well as other bodily systems. It also raises the risk of prostate cancer. Sodium. Consuming a lot of salt might exacerbate the symptoms of BPH related to the urinary system. For some men, it may be beneficial to follow a low-sodium diet that includes processed foods and salt from meals. Prostate changes that are not cancer. Prostatitis is simply the inflammation of the prostate. This means that you can become infected with bacteria, particularly if you are close to the urinary tract. It can also be caused by chemical irritation or inflammation of the prostate. Because urine can be caustic and cause inflammation without necessarily being bacterial. Benign prostatic hyperplasia, or BPH, represents mild hyperplasia of prostatics. So the benign portion indicates that it is not malignant. Hyperplasia is the technical term for just keep growing, and the prostate is obviously related to the process. As a result, I believe that more often than not, we just refer to it as BPH or an enlarged prostate, depending on what your urologist or primary care physician may say. BPH refers to the possibility of an enlarged prostate, which can then result in a functional obstruction of the prostate, also known as bladder outlet obstruction. Lower urinary tract symptoms are the other subjective terms that you may hear when speaking with urologists or primary care physicians. Let's talk about what you might be going through if you have BPH. First of all, it is important to understand that BPH is not the same as prostate cancer, nor does it cause it. In fact, what's more important to understand is that the two conditions can coexist. So you might be dealing with two different problems related to your prostate. But that does not mean they have to be related to each other. Additionally, they can have similar symptoms within addition. Your primary care physician could have ordered a PSA or prostate-specific antigen, which is more for prostate cancer, and screening for the prostate cancer than BPH, which just serves to further complicate matters. Thank you for watching my video. Also, do not forget to hit the like button and subscribe to my channel so that you can get more informative content